The ceasefire in Gaza is largely holding, but the struggle for survival continues. 2 years of war following the Hamas attacks on Israel not only killed tens of thousands of Palestinians, but it also flattened vast areas of the territory. For those left behind in the rubble, every day is a struggle for food, water and shelter.
When I saw the Rafah southern area in sector Gaza, I was completely down and upset because I saw everything is distracted. There is no city, there is no Rafah, there is no Khan Yunis.
We start in Gaza, where a fragile ceasefire has allowed displaced families to try to return. But the scale of destruction from Israel's war against Hamas is staggering. The United Nations says roughly 81% of all buildings in the territory are damaged or destroyed. As well as housing, that includes nearly every hospital and most of the schools. The UN says around 1.9 million people, that's nearly the entire population, were forced from their homes during the conflict. Now families are walking back to neighbourhoods that have been bombed out of existence. Streets are unrecognisable, maps no longer match the terrain, and entire districts have been reduced to rubble. We have this report from Mohammed Ibrahim in Gaza and Tanya Kramer in Jerusalem.
Getting ready to go back to Gaza City, Mahmoud Ayoub knows there's not much there. The family was displaced several times during the war. Now he's leaving their temporary quarters in central Gaza to check on their home. He knows what he's heading into.
After they announced another ceasefire, we returned to Gaza again and found our house further damaged. We keep tidying up and cleaning, but there's no life in Gaza at all. No water. There's absolutely no life there.
The coastal road leads through devastation. Whole neighborhoods of Gaza City are barely recognizable. The United Nations estimates that some 61 million tons of rubble in Gaza need to be cleared, and that this could take up to 30 years.
Do you see this? There's no road for us even to reach our home. Do you see how the streets are blocked and destroyed? There are no bulldozers to remove these piles of rubble.
It's not only dispiriting, it's also dangerous. He has to be extremely careful. There could be unexploded shells under the rubble. Ayoub's flat is in Sheikh Radwan, a neighborhood in the north of Gaza City. A few blocks further north and east, the Israeli military is still in charge, which means not everyone can go home, as this displaced young Palestinian explains.
We cannot go to the camp because it's in the yellow zone. If we go there, we'll die. They shell us and shoot at us. We can't reach our homes. We simply cannot get to them. They made this truce for nothing.
The so-called yellow line, the boundary, has not been clearly demarcated and leaves Israel in control of more than half of the Gaza Strip. Anyone approaching the area could be shot. Ayoub finally reaches his flat. The walls are still standing, but the area around the family home is unlivable. He's not sure when he will be able to return with his family.
What makes things hard for me at home is that there's no water. It's a long trip to bring water back, and we need to carry it up to the 5th floor on the stairs from far away.
Before the war, Ayoub worked as a porter in a shop, but he has no way to earn money right now. But that is not his greatest concern.
The war could restart at any moment, and there's no future for me here in the Gaza Strip because there's no life at all. Hopefully the truce continues without being breached so things can get better and this war stops.
The truce is only the first step. Rebuilding a life in this neighborhood will need a whole lot more.
Well, someone else trying to rebuild his life in Gaza is Dr. Ahmed Muhanna. Dr. Muhanna is director of Al-Awda hospital in northern Gaza. He was detained by Israeli forces in December 2023, just after the October 7 attacks. He was only released last month, and he joins us now from Deir al-Balah in the Gaza Strip. Welcome to DW, Doctor. Can we start back in October 2023? How did you hear about the October 7 attacks?
When I wake up early morning, I heard, I saw many rockets from Gaza to the Israeli side, and I directly went to the hospital. I'm director of Al-Awda hospital in the northern area. And I asked the committee in our hospital to organize a meeting, an urgent meeting, to organize an emergency situation in the hospital, because our hospital in the on the borders of the northern area. So it started the attacks from the Israeli sides on the civilians, Palestinian civilians, our peoples in the Jabalia camps and Beit Lahia, which located in the northern area. And we got hundreds patients, injured patients, from childs and ladies and the elderly in our hospital. Our hospital and specialized in gynecology and pediatric and general surgery. We immediately start receiving the patients and deal with them.
Right.
It's just starting 7th of October, and it's continue for weeks until 17th of December. For Israeli forces, they came to the hospital. And
all right, we'll come to that, Doctor. We'll come to that. Just to catch everyone up on what you've been saying. So you were at home. You saw the flares heading towards Israel. You went straight into hospital. And then as the Israeli counterattacks began, you saw Palestinian children, women and the elderly being brought into you. And what sort of... so these sound like civilians. These don't sound like fighters who were being brought into your hospital.
No, absolutely, because our hospital is NGO hospital, small hospital, non-governmental hospital, and I restrictly receiving just civilians injured in our hospital. And I told that for the Israeli, and I gave the servers and cameras from the cameras from 7th of October 2023 until 17th of December, to be clear that, and we haven't a refrigerator in our hospital to receive dead bodies also.
And so one of the consistent claims from Israel is that Hamas fighters organize their command centers and hide in Gaza hospitals. Your hospital, Al-Awda in northern Gaza, did you ever see any Hamas presence there?
Absolutely no. And we are not dealing with Hamas forces. Absolutely no. And it's not governmental hospital. The governmental hospitals, there was a lot of civilians, people inside the hospital, and it was crowded, the governmental hospital. But our hospital, we didn't allow for civilian peoples to come in the hospital. They're afraid from the bombs in the houses, and they going to the hospitals to be safe. But I refused that, and I kept my hospital away from the civilians.
Right. So a month after the horrific Hamas attacks on Israel and the Israeli counter response, you were detained. Talk us through what happened. Talk us through how you were detained and what you were told about the reasons for your detention.
Yeah, actually, they came to the hospital and they asked me, as a director of this hospital, they want to check the hospital. And I told that, yes, of course, we completely will be cooperative with you. And I asked my assistant to do everything what they are requesting. And after 8 hours of investigations with our staff, they detained 3 of our staff, 1 ambulance driver and 1 security agent and 1 nurse from the operation theaters. And after finishing, they told me that you can continue your work, but no one can cross the border of the hospital. Keep your stuff inside the hospital. I told it's okay, but after 3 minutes, they told me that you will come with us. Some delegation in Tel Aviv, they are inviting you to drink cup of coffee in Tel Aviv. I told it's okay. I told my staff that I'm under a detention now. They asked me to come with the staff, and I know that it's a detonation. And I asked the surgeon to deal with the hospital, and I spent more than 1 year and 10 months and didn't see the cup of coffee till now.
I mean, you can laugh about it now. I'm guessing it was horrendous. So Israeli forces detained you, said, come with us to Tel Aviv for a cup of coffee, kept you there for a year. What reason did they give for keeping you, and what were conditions like for you?
Okay, they asked me first one why I am not responding to the Israeli army when they asked me to evacuate the hospital. Actually, I cannot evacuate at this time because I had 50 patients, and there is no governmental hospital can receive the patients from our hospital because we are NGO, and I haven't enough number of ambulances to evacuate the patients. So I refused to evacuate the hospital for this reason. And second thing, they told me that you had militaries in the hospital, which is not true. I haven't any militaries in the hospital, and I'm civilian hospital. Third thing, they asked me that you should tell us where is the tunnels around the hospital. I told that I don't know. I am a doctor. I am coming from home to hospital every day and leaving at 5 o'clock, at 5 o'clock p.m. the hospital. I don't know. What about you're asking about tunnels? This is the and they asked me also if we treat injured Israeli soldiers in our hospital. Of course, we haven't any injured soldiers in our hospital, absolutely, and they know that, and they didn't cross the hospital, didn't enter the hospital. They just saw the hospital from inside by the phone, by the camera, and they asked me to evacuate the staff outside, and they start investigation with our staff outside the hospital.
Okay. So you were kept. They asked you to leave. You didn't leave. They accused you of hiding soldiers and covering up the tunnels, all of which you denied. You've talked about this questioning. Tell us about the conditions in which you were kept for, what was it, a year, 18 months?
1 year and 10 months.
Right.
Yes.
So nearly 2 years.
The condition was very hard, and it was very hard period in my life. And they deal with us not as a human being, actually. And we suffered first 7 months, especially first 7 months, from lack of medicine, no medical care, absolutely. No hygiene, no dignities. They didn't even we didn't change the clothes for 7 months, which developed skin diseases and scabies and other diseases, abscesses. And when I asked from the guardians antibiotics and cream and others supplements for guys and for prisoners, they told me, you are not doctor here. You are a terrorist. Go away. Don't ask anything. We will not respond to you. And we lost two guys from our prisoners, and inside they were healthy, absolutely healthy, but we lost because one of them complained from abdominal distension. It was intestinal obstruction,
Right.
and he needs just for referral to the hospital for emergency operation laparotomy, and they refused to do any intervention, and we lost him.
Let me just interrupt you there, Doctor, because I think it's important to be clear. You're saying that while you were detained by Israeli forces without charge, you as a doctor saw a need for urgent medical assistance within your detention, and that was refused, and at least two people died because the Israeli forces refused to believe you and they let these people die. That's what you're saying.
Yes, and the second case, he complained from chest infection, just chest infection. He needs just a little antibiotics, tablets, and that's it. They neglect him and didn't give anything. And the case developed pulmonary edema, and the patients became cyanotic and cannot breathe freely. And I asked emergency agent to intervene with this patient and to take him to the clinic urgently. They asked a nurse to come to the prison, and they start check him. They put a pulse oximeter on the finger. The saturation was very low. He called by phone doctor, and he start with the doctor start negotiation and explanation about the case.
By phone.
And within minutes, we lost the patient.
Right.
Within minutes.
So
I asked some emergency bag. Please give me the emergency bag. I am anesthesiologist. I can't do intubation for this patient for saving his life, but they refuse also.
Okay, so two needless deaths while you were being detained by Israeli forces without charge. That's what you're telling me. Tell us about your release. I understand you were released as part of the ceasefire deal. How did you find out you were being freed?
Find what?
How did you find out? How did you learn that you were being released?
Yes. Actually, they released me 13th of October 2025. About 1 month, 28 days.
Yes.
But, really, when I saw the Rafah southern area in sector Gaza, I was completely down and upset because I saw everything is distracted. There is no city, there is no Rafah, there is no Khan Yunis. And I saw the people, how they are living in the camps everywhere. And they looks, as refugees everywhere, and dirty babies, dirty childs, and with the dirty clothes.
Right.
And when I reached the hospital, Nasser Hospital, I saw my family and I saw my colleagues. I start rebreathe, and I felt that I get back to my life because I take my mother and my wife, my kids and my colleagues. Everybody is safe. It was fine, yes. And after that, I came to the hospital and I promised my colleagues that I will return back to the hospital to restart my job to save and serve the civilians. And in our organization, Al-Awda, and I am now 10 days when I restart my return to my job, to my work in Al-Awda, and I will do my best to keep our services to reach everyone needs to medical services, because the central health system here in Gaza is suffering, really suffering. The hospitals, 28 hospitals from 35 NGOs and governmental hospitals were damaged completely or partially damaged. And our hospitals is suffering from the diagnostic centers. We haven't diagnostic machines like X-ray machines, like CT, like MRI. How can keeping our work straightforward without this essential devices?
Right.
But we are starting adapted with this situation to do our best for our nations and our people.
That's quite a story you've told us, and thank you for sharing it with us. And we wish you well in your future endeavours. Thank you so much for talking to us, Dr. Ahmed Muhanna from Al-Awda Hospital in northern Gaza.
Thank you.
Thank you.
Thank you.